Today, in this audio lesson, we are going to see how to discuss and take consent from a patient or extraction of lower wisdom tooth.
Hello, Emma. I'm Dr. Samuel. I understand you're here to discuss the removal of your lower left wisdom tooth. How are you feeling about this procedure? Is there any update on your medical health?
Hello, Dr. Samuel. I am fine and don't have any update on my medical records. However, I'm a bit nervous. Why do I even need this surgery? Is it really necessary?
I completely understand your concerns, Emma. Let me explain. Your lower left wisdom tooth is impacted, meaning it hasn't come out straight. This has caused repeated pain and swelling. According to the National Institute of Clinical Excellence, NIC, guidelines, when these problems occur more than once, the best course of action is to remove the tooth to prevent future complications, which could get worse and happen more frequently over time.
Okay, but what exactly will happen during the surgery?
Great question. First, we'll numb the area using local anesthesia. You might feel a small scratch when we give the injection, but after that, the tooth and surrounding area will become completely numb. Once it's numb, we'll make a small incision in the gum, remove a bit of the bone around the tooth, and gently extract it. You won't feel any pain, just some pushing or pressure. After removing the tooth, we'll place stitches to close the wound and give you a gauze pack to control bleeding. You'll need to bite on the gauze for about 30 minutes.
Will it hurt afterward? How long will it take for me to recover?
After the procedure, you might feel some soreness and swelling for a few days, but we'll give you painkillers to manage that. If there's any sign of infection, we may also prescribe antibiotics. It's also normal to have some difficulty opening your mouth fully for a couple of days. I'd recommend taking 2 to 3 days off work to rest and recover.
I've heard about nerve damage. Is that something I need to worry about?
That's a very valid concern, Emma. The roots of this tooth are close to an important nerve called the inferior dental nerve. There's a 10 to 20% chance of temporary numbness or tingling in your lower lip, chin or tongue, but this usually resolves within a few days or weeks. The risk of permanent nerve damage is very small, less than 1%. There's also a slight chance of affecting another nerve, the lingual nerve, which could alter your taste sensation. This happens temporarily in about 2% of cases and permanently in less than 0.5%. I'll be very careful during the surgery to minimize these risks as much as possible.
Are there any other risks I should know about?
There are a few additional risks, although they're rare. Because we're working in a small space, there's a chance of damaging the teeth next to the one we're removing. You might also experience some bleeding or infection afterward, but we'll give you detailed aftercare instructions to help prevent this. If you have the habit of smoking, please stop smoking for a week so that the wound heals nicely. If you follow the advice we provide, these risks are minimal. That makes sense. What should I do after the surgery to recover well? After the procedure, you'll need to be gentle with the area. Avoid biting your numb lip or disturbing the wound because it'll be fragile. Stick to soft foods and avoid hot drinks for the first 24 hours. Keep the area clean, but don't rinse your mouth too vigorously. Avoid smoking, as I told previously. Also drink a lot of water and proteinaceous food. Don't eat too spicy or hot foods, both as in spicy and temperature. We'll give you written aftercare instructions to make it easier to follow. Do you have any other questions, Emma?
No, I think you've covered everything. Thank you.
I'm glad to hear that. If you're happy with everything we've discussed, can I have your permission to go ahead with the treatment? Thank you, Emma. We'll take good care of you. So let's go and start the procedure.